I just want to start and welcome everyone to our webinar today. I am Beth Johnson. I'm the Chief Community Engagement Officer here at the FSHD Society. And I am together here with my colleague, Ms. Jun Kinoshita. She's our Director of Research and Patient Education. And so together we'd like to welcome you to today's FSHD University webinar. For those of you that don't know us, the FSHD Society is the world's largest research-focused patient advocacy organization that's focused solely on FSHD is what I meant to say. We have over 30 volunteer-led chapters across the US and in Canada, and we are part of the 20-plus country World FSHD Alliance. Our mission worldwide is to find treatments and a cure for FSHD while empowering our families. We offer these free FSHD University webinars and so many other educational events, both in person and virtually, to educate and empower everyone affected by FSHD to become their own best advocate. And so today, we welcome our very own Jun Kinoshita to educate us all on the health economic study for FSHD that we are calling the True Cost of FSHD. It truly is one of the most important and urgent surveys we've ever done. And Jun is here to explain why it's so important and how to get involved. So now I will turn it over to Jun.
Thank you so much. Big theme for the FSHD Society that you're going to hear over and over again is trial-ready community. It takes all of us to accelerate this process and to make sure that we eliminate obstacles, all the obstacles we can, because it's already a difficult process to get a drug or new therapy to the market. So this True Cost of FSHD is, as Beth said, a landmark study. It is part of our trial readiness, and I will explain why it's so important and why we need everybody to be involved, because I want to really underscore this. Trial ready means not just, are you personally ready to be in a clinical trial? Because we know that there are eligibility criteria. Not everybody will be eligible for a trial, but every patient, every family still has a role to play in helping the whole process. And the True Cost of FSHD is a prime example of that. So this study is, why are we doing this? Treatments are coming, as I just said, and we're looking beyond that. When the FDA approves something, we want to make sure patients have access. And there's no guarantee that people will have access. We need to know things like how many people out there actually have FSHD. Is the benefit greater than the cost of the benefit of these new treatments? And when the drugs are available, who's going to have access? Who does not? How do we address that? What I show on the right here is there's this balance, cost versus benefit of the drug. And these are things that the Centers for Medicaid and Medicare Services will weigh when they determine how much they will pay for new therapies. That has an influence on all of these private insurance companies that will be, asked to cover new treatments. And there's an Institute for Clinical and Economic Review. We were just on a call with them. This is a nonprofit institution that's become pretty influential in determining, in that conversation about cost and benefit from, a broader healthcare perspective. So we need to be involved in this whole area. So we're looking at the socioeconomic cost of FSHD. Technically, this is called Health Economics Outcomes Research, or HEOR. And forgive us if we start throwing around acronyms, but we just want to introduce that one. So there are only 2 HEOR studies published to date of FSHD, and they're not even in the United States. One is this paper published in 2010 in Germany, and it involved a mix of patients with ALS, myasthenia gravis, and FSHD. So only, maybe a third of these patients had FSHD. And the second study was published last year from a Dutch group looking at FSHD patients in the Dutch National Registry. So these are studies that were done in European healthcare systems, where with nationalized healthcare, the cost borne by society is actually typically quite a bit lower than here. There are other limitations. For example, Dutch study only asked about costs incurred over the past 3 months. And all of you know there, if you live with FSHD, you're not, there may be spikes, like if you have to renovate your home, well, that maybe happened 5 years ago. You're not going to capture that in that 3-month, study. So, so we wanted to, based on what we know of FSHD, we felt it was important to undertake a study here in the U.S. And we are actually doing the studies ourselves rather than working with an academic institution. We obviously have a lot of advisors who are helping us, who have expertise in this area. But we also have a lot of expertise in our community and what patients go through. So that proved to be probably the most important factor in designing the study. So there are 2 parts to this. One is that we are looking at health insurance claims data from several huge data sets. We're working in collaboration with Optum, which has donated a pro bono team and donated access to their data in order to enable us to do this study. And we have identified patients using this ICD-10 code. That's an international coding system that provides a specific number for different types of medical conditions and procedures and so on. Believe it or not, in FSHD, there was not a unique code for FSHD until 2018. And the only reason we have that code is through an intensive kind of advocacy effort by Dan Perez and Pat Furlong of Parent Project Muscular Dystrophy. So there are now ICD-10 codes that distinguish between FSHD, Duchenne, Becker, and limb-girdle, I think. So with building on that work, we're now able to do a study like this. The second part of our study is this True Cost of FSHD survey. And with that, we're looking at all of the costs that are not captured by insurance claims data. So that's all the unreimbursed costs, the co-pays, the things that your insurer just wouldn't pay for, as well as things like impacts on your education, your work, the impact on family caregivers that might have to, say, give up a job in order to be able to provide care or go to part-time work and so on. There are a lot of what we call hidden costs that the only way we'll really learn about them is through you. That's why we're counting on our community to help us with this study. Our plan is to combine these findings into comprehensive reports. And our timeline is, we've actually been working over the whole past year in the design, setting up these relationships and finding the resources. We have begun educating you about this True Cost survey. So that's why we're doing this webinar today. And our plan is that in August, we'll be able to send that survey to all of you, and you'll have the month to kind of respond to the survey. And then by the end of the year, we're going to be analyzing this data through the fall and start to prepare manuscripts for publication. So I just want to quickly give you a snapshot of where we are with this Optum Health collaboration. This is this big 110 million patient claims database. Out of that, looking at people who had the ICD-10 code for FSHD, we identified 855 individuals who were probably diagnosed between October of 2018 and August of 2021. And of those people, 104 turned out to be duplicate records, so we had to eliminate those. So we're left with 751 individuals. And then out of those, there were 108 who were not seen, were not continuously enrolled in that healthcare program for more than 6 months. And we had to eliminate those because we don't have enough data to analyze on those individuals. So we're down to 643 people. And then out of those, about 385 were covered by private insurance and 261 were on Medicare. And that's something we need to bear in mind as we start to analyze this, because Medicare would mean obviously older individuals. Commercial payers would be a mix of older and younger, probably more younger people. We also noticed that with the people with private, commercial insurance, only 203 had pharmacy coverage. So nearly as large a number, 182 people had no pharmacy coverage. That's also something we need to bear in mind when we look at prescription drugs in this population. Well, if all those 182 people don't have coverage, maybe they're not purchasing drugs. Maybe they have treatments they should be taking but can't afford to. So we need to really think about that. On the Medicare side, we have almost everybody has pharmacy coverage. So we're really slicing and dicing this data. We'll be telling you more about that as we get more, we get a chance to analyze what's in there. So some of the questions we're asking are, basic demographics. Where are these patients? Are there hot spots that might indicate, say, that there's a care center there that's particularly good at diagnosing FSHD? What's the racial and ethnic diversity of this population? These are things that actually have never been determined on a national scale, so we're really excited to find out the answers to those questions. How many of those people have had genetic testing? What are the most common comorbidities? So, we're curious to know if maybe people were misdiagnosed with something else. Well, what are the most common misdiagnoses? Well, that's really helpful to know because we think a lot of people are never properly diagnosed, and maybe we can do an education campaign saying, if you have this patient that might have been misdiagnosed as something else, and have you looked at this and this? Maybe they actually have FSHD. The other thing we're curious about is, we've run across people who have both FSHD and, say, multiple sclerosis or rheumatoid arthritis. And there is an autoimmune component to FSHD. So it would be really interesting to know if there's a larger than expected prevalence of autoimmune disease in FSHD patients, for example. Or we could be looking at diabetes, other kinds of comorbidities. That might give us insight into some aspects of FSHD and how it interacts with other pathologies and so on. We're going to be looking at referrals to specialists. How many of those patients are being referred to physical therapists, occupational therapists, pulmonologists? What that tells us is what percentage of patients are receiving standard of care and what percentage are getting less than the standard of care. That's really important to know. What medicines are they being prescribed? What medical equipment are they being prescribed? What about their emergency room use and hospitalizations? Because we know that for falls and accidents are a big factor in FSHD, and that the cost of ending up in the emergency room might not be captured as an FSHD related cost unless we ask specifically. So those are some of the things we're looking at. Already, okay, this is very preliminary data, but what you see on this graph is 0 is the month that person's diagnosis appeared on their claims chart. And then month 1, 2, 3, 4, 5 after that diagnosis, and then month 1 and 2 before the diagnosis. What you're seeing is in that month, the amount spent on the amount that insurers paid for that individual. So you see this kind of peak at month 0, which is not surprising. They probably had a whole variety of procedures, diagnostic tests, et cetera, to determine that diagnosis. But what you also see is pretty high monthly costs in the months that followed, and also the months before, where they're probably also getting worked up. So if you tally that out over 1 year, in the year of diagnosis, that's already, you were looking at about $35,000 to $40,000 in claims reimbursements on average for patients. Well, that's very significant. So I'm now going to move on to the True Cost of FSHD study. So this is a survey that you're going to be getting, and we're putting it up on SurveyMonkey. It's adapted from several validated surveys. So survey design is actually very precise and subtle art. So we wanted to build on what's already great work that's already been done by Every Life Foundation, MDA, and so on. We took the questions we thought were most suitable for our survey, most relevant for FSHD, and then we got input from patient focus groups and also from industry partners, drug companies that are, doing their own health economic studies, and they're designing their trials. So we want to make sure that we're all kind of aligned in how we think about these things. So the patient focus group was incredibly involved and recommended additional questions that we hadn't thought of. So they added a lot of value to the process. And then the whole survey is going out to be reviewed by what's called an institutional review board. And we do that, that's required whenever you do a study involving human subjects, even a survey study. You really need that if you're planning to publish the study in peer-reviewed medical journals, which is our intention. So we're going through that as well. And I wanted to share with you what the survey consists of. So first of all, the overview is who is eligible. You need to be a resident of the US. You have to be in a household with FSHD in your household. We would like each household to fill out the survey, and we define a household as a group of people who live together, often related, but maybe sometimes not necessarily related, but they're part of an economic unit within that household. And as we know, since FSHD is familial, there may be more than one person in it who has FSHD. Our survey is designed to accommodate up to 4 affected individuals in the family. It just is, I know there might be some families with even more people, but it's just very hard to design like an online survey that has an undefined number of patients. So we decided to cap it at 4. And we want to emphasize that we take privacy very, very seriously. Your responses will be anonymous. So when you fill out the online survey, we won't know who you are. We're not going to ask for any personal identifying information. And that data is not going to be accessible to anyone apart from the analysts and statisticians who'll be looking at it. And of course, it's so very important to us that the data is accurate. So we don't want anyone to have any concerns about privacy that might keep them from providing all of the data that we're asking for. Part A of the survey will ask about demographics, kind of similar to what we're doing with Optum, but now we're asking you directly. It'll be really interesting to compare what you tell us against what the insurance claims data show. So we need to know things like how many people are in your household, how many people have FSHD in your household. We are going to ask if you have members in your household who are deceased. And we thought hard about this because we think, it might be difficult and painful for you to think about someone the loved one who's passed away. But if they had FSHD, sometimes the highest costs incurred are towards the end of life. And that needs to be part of the whole economic picture that we're trying to capture. So that's why we ask if you have someone who has been in your household who's no longer with you. We ask about, age, sex, race, marital status, your work status, education level, income, and also insurance coverage. Do you have private? Do you have Medicare? Do you have a mix of a combination? Is everybody covered by the same family policy, or do you have individuals who are covered by different policies? And it's, with this starts to get a little cumbersome where you might have to kind of track down some paperwork to just figure out exactly what type of coverage different family members have. So that might be something you might want to do as a little bit of homework before you start the survey. As I said, accuracy is important, but we also don't want you to go crazy. We don't need to know every last cent. If you just basically ballpark, it was about $10,000, give or take 1,000 or something, that's okay. Use your best estimate. We don't want you to drive yourselves crazy trying to nail down the exact dollar amounts of everything. Part B, we're going to ask for detailed financial expenses. So costs for making adaptations to your home, to your vehicles, out-of-pocket medical equipment and medications, out-of-pocket spent on physical therapy, trainers, massage, acupuncture, etc. Anything, basically any cost that if you did not have FSHD, you would not have incurred is basically the way to think about it. That applies also just, day-to-day costs. If you needed to order a special taxi, wheelchair accessible taxi, and costs more to get it. Adaptive gear you need to be able to keep working or or to participate in family vacations and so on. Those are all costs that are due to having FSHD. Educational expenses, for example, if you need to learn how to drive with a special adaptations in your car, we know some of those classes can cost a lot. If you need adaptations to be able to attend college classes or graduate school or other types of educational opportunities, we want to know those as well. Part C is asking about health. So your symptom history, your current mobility and function, other diagnoses you have. We'll be asking about reproductive health. We know couples who decide to do in vitro fertilization with pre-implantation genetic diagnosis. That's a very costly procedure. We need to know what those cost. And health provider visits per year. What kind of specialists are you seeing? And COVID has really complicated this issue because during COVID lockdown, maybe you stopped seeing doctors, you stopped seeing your physical therapist. So we want you to try to recall what you were seeing typically before the lockdown. And then we'll also ask what happened during the lockdown. And then we'll ask about home care. Do you have a paid aide who comes, or home nursing, et cetera, as well as unpaid caregiving. We'll ask about that as well. And then part D is looking at your work situation, both for those of you who have FSHD and for your family care partners, because they may take on a considerable burden there. For example, if you had to change your employment situation to be more available to provide care for family members. So we're asking about both paid and unpaid work. We're asking about education. Did you have to give up an educational opportunity because of disability? Did you have to give up work opportunities because of disability? Did you have to change your job, go from full-time to part-time, et cetera? And also, is there lost income due to government rules for Social Security and disability? For example, they limit how much you can be earning. So perhaps you have the ability to earn more, but in order to get the disability benefit, you had to actually cut back on your earnings. That's one possibility. Another is that in your career, that you decided you're going to keep working and thereby missed out on having, some benefits that would have helped you economically. So we'll ask about those things. And then the final part of the survey, which is the shortest, is called the EQ5D5L questionnaire. It's only 5 questions asking about mobility, self-care, your usual activities, pain, discomfort, anxiety, and depression. The only thing about this part of the survey is that each person with FSHD in the household needs to answer it for themselves. So you may be, a parent and you have 2 kids who are, busy all the time, and but you really shouldn't answer on their behalf. You should kind of collar them and, get them to answer for themselves. So what are we going to do with all of this data? We are planning to publish it in a number of influential journals in this health economics space. And the reason we do that is that raises the credibility. It's like a good housekeeping seal. We've written something that's passed through peer review, it's publishable, and those have carry weight with institutions like the Centers for Medicare and Medicaid, the Institution for Clinical and Economic Review, which is a private nonprofit that has a lot of influence in determining, the economic benefit of new therapies, and of course with all of the private payers that are out there. And our timeline is we are in the middle of the educational campaign. We're currently recruiting study participants. You can go on our website. I'm sure you've gotten emails where you can sign up to let us know you want to participate. In August, we'll send out an email with the link to the survey itself. And then starting in September, we'll be doing the data analysis and so on. So please take part. Join the study. So keep an eye out for our emails. Invite other household members, separate households to participate, and also alert people in your family this is going to be going on in August. Make sure you catch our emails inviting you to take the survey. And I want to thank Optum, MDA, Every Life Foundation, as well as Jamshid and Marina Kolotavina, Michael Lam at Optum, and Marie-Fel Despalan, who have been so enormously helpful. They are my collaborators in this effort. And that is it. If you have questions, I'm here.
Yes, we actually have a few questions. And so hopefully you can answer these. Kind of a general overall question is, I always go back to, what's in it for me in the long run? And one of our participants said, will the study results actually potentially help patients receive care through insurance? She gave an example of getting physical therapy every week, but now she has to pay out of pocket and it's very expensive. So what is the end benefit to people from this study?
That's interesting. I think it should help with other things like physical therapy as well. As I said, there's never been a study in the US looking at the full economic impact of FSHD. So it just provides more documentation, evidence to go to payers and to reset policy around reimbursement for all kinds of treatments. But we particularly have our eyes on things like the fulcrum drug, if it is approved by the FDA, or the other drugs that are coming down the line. They're going to be costly, and especially like the mRNA drugs. I mean, the manufacturing cost on those is very high. The companies are investing a lot of, hundreds of millions in developing these drugs. So we want to make sure those will be reimbursed adequately when they come on the market. So in terms of what's in it for you, this is all to ensure that you have access from an economic standpoint to therapies. We're really telling the value story of any therapy, how it can help you, and why it's worth paying for it.
Good. Someone asked a quick question that we can probably answer quickly. You were talking about the ICD-10 code, and people want to make their physicians or their doctors aware so that they can put that on the record. Can you tell us again what that code is? And I will type it in the chat.
Gosh, I'm going to get this wrong.
Is it 71.02?
That's what I think. 71.02 is what comes to mind.
So I will put that in the chat, and take note. And next time you talk to your doctor, if they haven't already, put that on your record. That's something to take with them so that they can include that in your diagnosis record. Yeah,
that was one of the shockers, I guess, about looking at the payer data. Is we said there's got to be a lot more FSHD patients out there, but if you were diagnosed before 2018, it's highly unlikely that you come in for a follow-up checkup with your doctor that they're going to think to add the code now. They it's not going to be on their radar unless you raise it with them.
Right.
Yeah.
Couple of questions about historical data. People are asking, can we go, how far back can we go in providing information about expenses? Last year, 10 years ago?
We're looking at lifetime costs. So anything you can think of, and we're not going to ask you to adjust for inflation, just, do your best with what you can remember. If you kept any records at all or have any way to remind yourself. And we want to alert you now because, sometimes like just sitting around and thinking about it or having a conversation with family members, you might remember things that don't come to mind right off the bat. So.
Right. Good. Okay. I had a question actually. On one of your slides, you were listing the eligibility criteria and you said a household, and a household are people that live together. What about, say, if I was a parent and I had an adult child and I bought a wheelchair or a van conversion kit or something like that for my child who doesn't live with me, who has FSH, would that work? Would that count?
That's a good question. I think so. I think you can, if you paid for it. I think for that purpose, like economically, your child is still in your household. I mean, boy, I hadn't thought about that. I mean, what we
because we know people that are in that situation,
yeah,
right?
yes,
know people.
Yeah. Mm-hmm. So what we're trying to avoid is double counting. So you could also say, okay, you're in a separate household, although we paid for this wheelchair. Why don't you say, put it on your account, like answer, you answer the survey separately as a separate household and, just figure out where it's going to be measured. Yeah, I'm sorry, That's not a perfect answer, but
no,
life is so complicated. Sense. That's why these surveys are so hard to design.
It makes sense. I think you would just need to communicate with your family members to ensure that, this isn't a duplicate information that's being submitted. Okay. Several questions about, locations, countries that are included. And you had mentioned that it's US based only. Can you tell us, number one, why it's US based? And then there's several people that have asked if we're going to include other countries or if other organizations are going to do this within their country.
Yes. So this has to be just US based because we have a very peculiar healthcare system, and the costs of things in the US are very different from costs anywhere else. So to have validity as, and the payers are also, we're addressing US insurance companies and US government. So that's why it's US focused. However, we are strongly encouraging patient advocacy groups in other countries to do a similar health economic study. So we're already talking to advocates in the UK and Canada and sharing like our survey, like you can use our survey as a basis. Maybe not all the questions apply. You might have to adapt it to your country, conditions in your country, but at least you don't have to reinvent the wheel, and the more we can use kind of a standard set of questions, the more it'll be, you can then do comparisons across countries and do interesting things down the road. But we are encouraging other countries to do their own health economic studies, and also to educate yourselves about who decides access to their medications in your country. What is the ministry or agency that's involved? And to begin a dialogue with them to raise their awareness about the impact of FSHD in your particular country. This is why through the World FSHD Alliance, we've been working to kind of activate patient advocacy in other countries, because this is coming. We don't, it would break our heart to have a drug on the market here that you don't have access to somewhere else because you didn't, know who to talk to, didn't know how to advocate for reimbursement or coverage in your country about that. So we're working through the FSHD Alliance to share those learnings and develop strategy kind of globally.
Right, good. And that's That's great. And I think the World FSHD Alliance is a place for us to start with that, and using examples and not having to reinvent the wheel in every country. So that's great. There was a comment that I don't know if you want to comment. We had a member or a participant saying that he doesn't remember having to choose a separate prescription plan with private insurance versus now being on Medicare. So he thought that maybe the number you presented earlier on might have been a bit skewed, but you would guess that many of the people on private insurance do in fact have prescription coverage, but not on a separate policy. Does that make sense? Do you think those numbers might have been skewed that we presented early on?
I will have to ask the Optum people. I mean, they're they are experts in how insurance companies are structured and policies are structured. So I think that's a good question. I don't know the answer to that.
I told him we'd follow up with that after we get with our Optum folks.
Yeah.
And we have a participant asking, what about marijuana? Are those expenses included, medical marijuana?
Yeah, that would be under those unreimbursed, unless you have an insurer that covers it for you. But generally, probably that's an out-of-pocket. And if you're getting relief from marijuana products, yes, definitely include those costs.
Great. Hillary asks a really interesting question. So for those of us who receive help from caregivers in our households, which that happens quite a bit, is there a tool or something that will help us figure out how much those unpaid services are really worth?
That's a good question. We'll look at that. I think, just as a rough, I mean, if your caregiver was previously employed, that might be a benchmark of like, that's the income they have given up by stopping work. Or you could look at sort of average wages or earned income in your area and use that as a benchmark. We'll look and see if there's a tool for that. That's a good question.
Yeah. And, they always say, the cost of, being a mother. So, if we were to pay someone to come into your house and care for your kids, 8 hours a day, what would you have to pay that person? And that's, a salary that a mother or a father would get who stayed home with their children. So there is that
24 hours. You need three shifts. You need 3 shifts, an overnight person, like nobody could afford it.
That's great. Let's see. Don is asking, will there be a way in the survey to tell an economic story where we don't have concrete numbers to put in? For those of us with multiple people in our extended family, there are definitely trends that are similar, and narratives could help uncover questions we didn't really know to ask. It's a long question, but I get what he's saying. How do they tell the long economic story?
Well, that's, we're looking at, in relation to this is just like evolving. Like, I think there are going to be other follow-up studies and analyses. So there's something called patient journey map, where we're trying to kind of tell more of the story in a longitudinal way. And in FSHD, there might be different typical patient journey maps, and that's something that might involve interviews as well as data collection to kind of see, I think the testimonials kind of enhance and flesh out what we're seeing in like a data collection based, evidence-based data. So send me an email and let me know you'd be interested in being part of our focus group for developing patient journey maps.
I think Don definitely would.
Yeah.
I think you might have answered this question, but it's been asked several times. So let's just clarify. In terms of costs of medical care, are we looking for the full cost, which would include both insurance coverage and out-of-pocket coverage? Or are we going to get the insurance coverage from somewhere else and get the out-of-pocket from the individuals?
Let's see. I think the questions will ask for both.
Okay.
So I think
Great.
we're more focused on the out of pocket, but I think we're also, if you have it, if you know, sometimes we don't know what the insurance is paying for all this stuff, right? But if you have that, I think there are places to provide that data.
Final thing is, if someone wants to participate and they want to make sure that they get the email with a link to the survey because they want to participate, what is the best way for people to do that?
I'm going to drop it in the chat right now. No, there's a special landing page. I'm going to drop it in right now.
Thank you.
Great.
That would be great. That will, you know, help us, and we can follow up with you directly if, you know, you didn't get it and so on.
Everything that you submit in the survey is completely de-identified. So even though you are signing up with us to declare that you want to participate in the study, the system where the survey is being housed is separate. And so everyone should know that your answers in the survey are not connected to your record with us at all. So they are completely de-identified in the survey.
Well, thank you everyone for attending our FSHD University webinar today. Thank you, June, our wonderful in-house expert. Ms. June Kinoshita is a superstar in our world, so thank you so much. Our next webinar is August the 18th at the same time, 1 o'clock Eastern. Our guest speaker this time is going to be psychologist and FSHD patient, Kent Drescher. Many of you know him. He's going to discuss resilience in FSHD and share some recent research on this topic. And he's always so interesting and great to listen to. We have so many great events coming up, including our Walk and Roll Team Happy Hour next Thursday afternoon. So please visit our website events calendar for all of these upcoming amazing chapter, wellness, educational events. They're all on our calendar on the website. So thanks again for joining us today, everybody, and we will see you next time. Bye-bye for now.